Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Even even meatless even meatless products can also give you protein, but it's this the protein from the meat is more likely when it's digested to result in increased ammonia levels and encephalopathy.
What is a diabetic coma, doctor?
Diabetic coma is a coma that occurs after your blood sugar gets very high and you have breakdown of uh, ketones and you get acidosis and people die in coma from diabetes when the blood sugar gets too high and it's not treated with insulin. So that you can have coma from a number of mechanisms. You can have coma from trauma. You can have coma from uh, poisons. You can have coma from protein if your liver's not working, and then of course you have coma from brain tumors and other things. So coma is a state in which you're not conscious. Right. Any other questions about liver disease? And of course, when we talk about cirrhosis, we'll talk about liver disease and where the liver cells are replaced by normal liver cells are killed and replaced by fat often.
Dr. Callender, do they sometimes call that fatty liver?
That is one cause of cirrhosis, but as you know, there are many causes of cirrhosis: alcoholic cirrhosis, cirrhosis from fatty liver disease, and so on.
Another question I had was, I think you mentioned a while back that the protein that you get from meat, well, the non-meat protein is different from the protein that you get from meat.
Yeah, that's correct, and that's why they suggested for those people who couldn't eat meat burgers that they had vegetable burgers, which didn't cause the same level of encephalopathy. Okay, any other comments? If not, we go to the next one. Now, this is a subject for the Tuesday section on health had an article on this as well, talking about that not only is the APOE4 gene associated with Alzheimer's, but in 20% of the cases, it actually causes Alzheimer's disease. And so if you have two genes of the APOE4, that 20% of the population that has Alzheimer's, it is the cause of Alzheimer's. So uh, we're seeing more and more articles that are demonstrating the importance of knowing the genetic makeup of certain diseases, and this now is probably the only real disease that we know that the only genetic association that is associated with the cause of Alzheimer's. So if you have two APOE4 genes, 20% of the people who have those actually have Alzheimer's.
And Dr. Callender, how do you know you have that gene? I mean,
you have to have gene tests, have genetic profile testing.
is a gene test the same as just blood test?
Yes, a blood test. Yeah.
Oh,
Dr. Callender, is that similar to what you can do with cancer, the BRCA gene? if you have that?
Well, the BRCA gene is one of the genes that is associated with cancer. So far, this is the only gene that is associated with Alzheimer's. There are a lot of other genetic diseases. Genetic kidney disease, APOL1, is associated with FSGS, or one of the common types of glomerulonephritis that affects particularly Black people. So that we're getting more and more evidence that it's important to get some genetic tests to identify some diseases.
Dr. Callender, on these genetic tests, I got a phone call. They want to do a genetic test. And so find out about heredity and diseases acquired through the gene. So the point I want to ask you is, when you're 70, 75, 80, 85, and so forth, and they figured out that, you have some of your diseases are heredity. And so if you're 85 years old, 80 years old, what can be done about it at that point?
Well, it's not as important for you as it is important for the rest of your family, because your gene pool is distributed among your family. And so while it may not help you, it may help other members of your family, younger members of your family. For you, it may not be helpful, but it may be very helpful for your children, grandchildren, great-grandchildren.
Got it.
I was thinking the same thing, Dr. Callender. If you're tested as a child and find that you have homozygous for the APOE4, what can be done if you're a child?
Nothing. And that one of the problems with Alzheimer's is we don't have a way of treating Alzheimer's. So, but it would get you to do those things that are more likely to be preventative of Alzheimer's. In other words, diet and exercise and meditation, all of those preventive things that we talk about on this program. I think those are the things that it would benefit you to take advantage of that, to think that you're likely to get Alzheimer's. But as we know, because you have a gene doesn't mean that you will necessarily have it. But what it means is if you don't modify your lifestyle, it is more likely that you will come down with it. So that for a child who learns that they have APOE4, you suggest that they adopt a healthy lifestyle as early as possible to try to prevent the development of Alzheimer's. So to me, that's what you would get from early gene testing, is to try to modify your lifestyle so that the likelihood of your gene predisposition does not actually result in your getting that disease.
I see. Okay, and the next article talks about another version of that.
Okay, this is a association a little different with plasma leptin level. That's a lipid-associated moiety that is found, and it's thought that if you have high plasma leptin levels, you have less likelihood to develop Alzheimer's. Whereas if you have low plasma leptin levels, then this study shows that you're more likely to have to develop Alzheimer's. Now, the cause and effect really have not been demonstrated, but it has been shown that the association is there. Now, how many of us get leptin levels? Probably very few of us. But this is an association with Alzheimer's disease that we're just identifying, and over time, we'll be able to learn whether this is something that we can modify our diet as well as lifestyle to increase the plasma leptin level. And so this is one of the first associations that has come up. And so over time, we will find out how we can modify leptin levels, if in point of fact it is causative of Alzheimer's or whether it's just an association. Can't hear you, John.
There's a link to a video here, but I don't think it's going to work. But
No, I don't think so.
folks at home can click on that in the article and play that video when you look at the at this article. Okay.
Okay, if no comments, the next one. This is an interesting article. It talks about the fact that the gold standard for colorectal screening is colonoscopy, and that is the best test. But there are other diagnostic tests, and stool tests, and blood tests that can diagnose whether you have cancer. But in terms of the best screening test for colon cancer, colonoscopy is probably the best. Although you have other ways of doing that. You have colonoscopy, you can have the CAT scan with the getting dye through the colon to take a picture of the, and that there are other ways. And so there are blood tests that can actually identify whether you have a colon cancer. But in terms of the screening, it is the best test. But there are such a significant number of people who won't get the test because of the fact that they don't want to be put to sleep. They don't want to go through the rigors of the
Prep.
of what you have to take in order to get your colon clean. They give you a number of fluids that you have to take that will clean out your colon, so that then when they do the colonoscopy, they can complete a clean colon. And sometimes this prep is so uncomfortable that some people don't want to go through the rigors of that. But it remains the gold standard for it. But we have more tests now, stool tests and blood tests. So if you have blood in your stool, that's a good reason for you to get colonoscopy. If you have a blood test that shows that your DNA is likely to be associated with colorectal cancer, that's another reason for you to get a colonoscopy, or to get a test, a CAT scan. Can't get that. The new mTSDNA test is really more suggestive of cancer than that's more diagnostic than a screen. A screen is a test that looks to see if we can find polyps, which are the forerunners of cancer. They're not cancer, but they're forerunners of cancer. And so that's why you screen, to try to get it done before you develop cancer, rather than the mtDSNA, which actually is a test for colon cancer. Any other comments or questions? Because this is a topic that is very important in terms of screening for colorectal cancer, one of the top 5 causes of mortality for cancer in the United States.
Dr. Callender, are these tests expensive? The mtDNA?
What is your question?
If
Is that
everybody,
expensive cancer? Yes, it is.
are the tests expensive? That's my question.
I didn't understand the question.
Are the tests expensive?
Oh, I don't know anything about the cost of the test. And it doesn't say anything here about the cost of the test. And I'm unaware of the cost of that DNA testing.
Dr. Callender,
It sounds like you get some of these other tests, and if they become positive, you still got to go back to the gold standard.
Yes, that's correct. You still have to go back to the colonoscopy.
Yes, good morning, everybody. That is correct. You remember I mentioned on one of our calls that my last colonoscopy, the doctor didn't get all the way up to the upper part. And so I've been trying to locate to go and have it. You told me, Dr. Callender, that I really didn't have a colonoscopy if they didn't complete it. So this coming Tuesday, I'm going to get a colonoscopy, but what the doctor wanted me to do was to get something similar to an MRI. But when I talked to the nurse practitioner of the doctor I'm getting ready to have the colonoscopy with, I don't think the cost was any concern if I went to get the MRI. But if they found anything, just like someone just said, I would still have to have the colonoscopy. So I'm just opting to have the colonoscopy and get it over with.
Thank you for sharing. Any other comments? If not, go to the next. This is another idea: is if you have a negative colonoscopy, is the 10-year rule good enough, or can you wait for 15 years? Well, we haven't done the test in the United States, but they've done it in Sweden, and they found that you could get away with waiting 15 years. Because you can get away with it doesn't mean that you should be done, but it's food for thought. This is saying that in their test, up to 15 years after negative colonoscopy, the risk was very small. So question is, do you stick with the 10 years, go for 15 years? And so far, we haven't done enough studies to give a great answer for that. We can say that when they did it in Sweden, that it seemed as though that worked. Whether that would work for the United States and the people of color, I don't know. But it's food for thought that 10 year may not be necessarily the length. It could be longer. But as you know, if you have a polyp, then it's every 3 to 5 years. Whereas if you have no polyps, then it's completely negative. The question is whether it should be 10 years or longer. That's what this article is talking about.
Dr. Callender, if they do a colonoscopy and they find polyps, how often, and they remove them, how often are you supposed to have the next colonoscopy? Somebody said every
3 to 5
3
years.
years, every
3
5
to
years,
5 years. 3 to 5 years.
3 to 5 years.
Yeah.
And would that be consistent? Years ago, the doctor found polyps. So instead of 10 years, I'm doing 5 years. But I've had a 5-year exam the last 3 times, I guess. So I guess that means 15 years. So I guess that will be throughout my lifetime, 5 years.
Well, it depends on your doctor, because most people, if you're free of polyps, would say that you could wait 10 years. So it varies. And most people think it's 10 years if you have no polyps, 5 years if you have polyps, 3 to 5 years if you have polyps. But as this limitation points out, this is this is Sweden and white patients. Whether this is applicable to people of color remains to be seen.
I'm sorry, I had it delivered.
Dr. Callender,
Yes,
my father had colon cancer, and I had an uncle that died of it. My father didn't die of it, but he had it. So they had my brother and I coming in every 2 years. And then since we didn't have any polyps, he told us we could go to 5, but if we ever develop another polyp, then we have to go back to 2.
it makes sense. When you have a family history of colon cancer, then they're more concerned about you developing cancer. So that fits in with what is recommended.
Dr. Callender, another issue that I've heard about is that whether the polyp is malignant or benign.
Well, it's not an issue whether it's malignant or benign, because if it's benign, you take it out. If it's malignant, then you have to have surgery to have it taken out and part of your colon removed. So if it's benign, all that means is that you have it removed and you follow up. If it's cancer, then that's a different story. This is an article that ties prenatal cannabis and nicotine to adverse maternal and neonatal outcomes. I don't think there's been a study that looked at the association of cannabis and nicotine to the maternal and neonatal mortality. But this study, for the first time, suggests that the association of both results in neonatal as well as maternal deaths. And so it's recommending that pregnant women refrain from both. And this is, I think, one of the first studies I've seen that actually identifies the association of cannabis and nicotine, and we'll probably need further studies with larger numbers to, although the numbers are significant, but the numbers aren't as large as they could be. I think we need to have additional studies to follow this up. But the recommendation is that pregnant women should restrain from nicotine and cannabis.
Dr. Callender, a study should also be done about prenatal cannabis and nicotine use and the long-term effect of mental disorder on the kids that are born from this situation.
Okay, all right. That's a study that is kind of nebulous, but it suggests that we don't know as much about consciousness as we should, and how your brain handles metals can give you a clue as to how your brain is going to respond to everything else. This is kind of a study that points out that we don't know as much about consciousness as we ought to know, and that we really are far behind in understanding how our intelligence is all about. But it does suggest that the way in which our brains handle metals may give us a clue. But this is a study from Jerusalem, and whether it's applicable to all ethnic groups remains to be seen. And it's a pretty early study, and it's it's food for thought, and probably I wanted to include it because sometimes these early findings turn out to be of merit. Whether this will be the case in this, I'm not sure or not. But there's nothing in this article that really identifies anything other than the fact that if that the way your brain handles metals may give you a clue as to how how your memory will be later on in life. But this is not, the data is not strong enough to merit any conclusion other than that this is very exploratory. Let's go to the next one. Now this is something that still hasn't been proven, but the Neuralink brain chip is put in the brain so that people who have had strokes can, by their thought processes, can move a keyboard and have the ability to control a computer cursor or keyboard by thought alone. And this is done by they got a year ago. They got Elon Musk got approval to start implanting these. They had some trouble with it because sometimes it was dislodged itself, but when it was there, it allowed for rapid improvement and the ability to use the computer just by brain thought alone. And so down the road, this well may be something for people who had strokes and other diseases in which they cannot use their limbs, but they can use their thought processes to use the computer. So this is something that's not yet been, it is now being tested, but it's not yet been given the FDA approval. They have FDA approval for implanting, but they haven't done the clinical study yet. But it shows promise in terms of people who have diseases in which they don't have muscular control, but their minds are still functional, that they can use the cursor and the computer just by their thought processes. So this is something down the road which will help people who have many of these muscular diseases, but whose brains are still functioning.
And Dr. Callender, I believe that this is probably super expensive.
Well, yeah, well, anything that's experimental is expensive, right? Now, this is an alarming comment that this infectious disease expert has, and he's saying that if we can continue to misuse and abuse antibiotics for our food sources, the animals and other things, that what will happen to us will be what happened to his godchild who died of antibiotic resistant infection. She had other reasons why, because she had a transplant and she's immunocompromised. But he's recommending that if we don't change our processes of misusing and abusing antibiotics, that we will have more infection-resistant germs, antibiotic-resistant germs. And so he's warning us so that we would try to use antibiotics when necessary and when unnecessary to avoid them, so that we don't get so many drug-resistant infections, which if they're drug-resistant, then our ability to treat them is lost. And so he fears that if we continue to abuse the use of antibiotics, that we will lose more people from infection, much more than we lost from COVID. So that's what this article is all about, trying to get the community globally as well as nationally to use antibiotics properly and not abuse them so that we don't get so many drug-resistant infections.
I just want to stress the point that the antibiotic resistance is coming from, for the most part, is coming from eating meat because, and it's American meat that's the problem. Conventional meat, if it's beef, pork, or chicken, typically they're treated with antibiotics because for the most part they're fed with grain. Grain makes them sick. Antibiotics gets them to market. And it's not their natural diet, but it's cheap. And so that's what you're getting with American meat. You're getting meat that's full of antibiotics. So if you're going to eat meat, probably the best thing to do is to eat organic because then you're not going to get meat with antibiotics. If you're going to eat beef, get it grass fed. It's more expensive, but then your meat won't kill you. And then best case scenario is just to eat a plant-based diet where you're not dealing with the antibiotics or meat at all.
Thanks for your comment. Any other comments or questions?
I heard somewhere that the antibiotics also go into the water, and fish eat the antibiotics. It affects the whole biosystem, not just the meat.
Yeah, particularly with farm-raised fish like catfish, salmon. They pump a lot of antibiotics into the farm-raised fish because then again they're feeding them grains instead of their natural diet.
Any other comments about it? Thanks for sharing. Okay, let's go to the next one. This is a note that the COVID-19 public education campaign by HHS saved more than 50,000 lives. We all remember how at the beginning of the pandemic that people were not getting the COVID vaccine. And so they put out these campaigns to increase the education of the public so they would get vaccinated and wear masks and do those things that are essential to preventing COVID. And that more than 50,000 lives were saved by these public education campaigns. And they described some of the ways in which they traced these public education campaigns and how they move people to change their behaviors, wash their hands and wear masks and also get vaccinated. And this campaign resulted in, as you see, the number of lives saved. And so public education works. And I think information is power. And the more information you have, an ounce of prevention is worth a pound of cure. And so the better off we are. And that's the essence of this article. And it's important not only for us to have public education campaigns, but also to actually get into the community and educate and empower the community to adopt healthy lifestyles. But it's nice to get data that shows that it works. Next one, please. Although that is the case, now that total trust in vaccine has declined, among teenagers and their parents. And they showed that only 46% of patients, parents, and 30% of teenagers feel it's important to receive the COVID vaccines. So it looks like we need more public education campaigns. So it was one thing when we had the pandemic. Now that the pandemic is over, some of them no longer think they need to take the vaccine. And that's disturbing, but it's something nonetheless that we have to deal with. Any comments or thoughts about this article? Now, this is an article that's even more frightening, though, and that it talks about the lack of HPV vaccination in the United States. We know that HPV is the cause of cervical cancer, and we know that cervical cancer is fatal in women, and that if we knock out HPV by the vaccine, we knock out cervical cancer. However, unfortunately, the HPV vaccine has not always been available. And so for the people who are aged from above 20, they didn't have HPV vaccines when they were in school. And so they need to get the HPV vaccine. But what is frightening is that only 1 in 5 insured males and 1 in 3 females were vaccinated. Now, keep in mind that the disease comes from the males, and the males give the vaccine to the females. And so it is more important that the males be vaccinated than the females be vaccinated, although it's important that both be vaccinated. And so when we have a situation in which HPV is very common and women are not vaccinated, and the men are not vaccinated, the likelihood of cervical cancer killing women and killing men with head and neck cancers becomes even greater. So this is something that is alarming, and we need to do something about it because it is killing men and women. And actually, it's killing more women than it is men. And because it's killing women at an earlier age and men at a much later age from oropharyngeal cancers. Any comments about HPV and the fact that many of the parents are not insisting that the children receive the vaccine, the males and the females? Okay, if no comment, food for thought so that your children, grandchildren, great-grandchildren will get these vaccines, especially for the women who get infected by the men.
One question I had, Dr. Callender, is this disease, does it react, is it dormant in the body?
I didn't understand the question again.
Is this disease dormant in the body? I mean, can you be a carrier and not realize it?
Oh, men are carriers of HPV. They also get HPV. So it's both. They do both. They carry it and they get it. The difference is that the target organ for the women is the cervix, and the target organ for the men varies. If they have sex by normal fashion, or if they have anorectal sex, they get HPV granulomas in the anorectal area. And if they perform cunnilingus, they also get head and neck cancers, so that it's both for men. They're carriers as well as recipients of HPV. But it's just that they are the ones who infect the women with cervical cancer, which causes them to die from it. Does that answer your question?
Yeah, but a follow-up is that how do you know when you have it?
Do you know when you have it? Not necessarily, because it takes years for it to manifest itself. Those who have, for example, men who have sex with men may have papillomas that occur from HPV in the anal rectal areas. And so they may not recognize that these papillomas are a consequence of sexual intercourse, and may not realize that they have it and they're infecting others. So, so you may or may not know that you have these papillomas, but these papillomas are evidence of infection.
Yeah, that answers the question for men. And how do women know whether they have it or not?
Did I answer your question, or did you ask another one?
Yeah, you answered the question for men. You said that they may or may not know it. So I was asking an additional question about women. Is it the same case? They may or may not know they have it.
Right, because if they have lesions, they don't go to the doctor, they wouldn't know that they have it. I've had some of my male patients who have papillomas because they have anal sex, and they don't realize, but sometimes they grow and they get multiple papillomas, and then they go to the doctor then finds the lesions, and then the disease is identified. But just as many of the sexually transmitted diseases, and this is one of them, does require, it has symptoms, but the symptoms may not be significant enough for them to go to a doctor about it.
And thank you. That answers the question. Yes, thank you.
That's a good reason why it's so important to get the vaccine.
Yeah, exactly. And that's why it's important for parents to make sure that their children get the vaccine when they go to school. And then if they don't get it in school, then they run the risk of dying from cervical cancer. And you know, I've had too many young women that I know of who've died from cervical cancer, and it's a preventable disease. This is an article that talks about a new alternative to CPAP for people who have obstructive sleep apnea. And this is something that is designed but has not really been approved yet. But it's likely to become approved soon. But what it does is that it's less rigorous in its putting on the CPAP. Right now, the CPAP is kind of has to be pretty much airtight, and so they have this vortex application that doesn't require it to be airtight, and this makes it more comfortable for the person with CPAP. And so, when it becomes available, it may be something that will be more easy to use and to overcome the obstructive sleep apnea. And so they don't have the numbers yet to demonstrate its benefit over CPAP, but down the road, this may well be something, the vortex application may be something that more people who use CPAP may find easier to use than the CPAP machine that they have. So this is coming down the road, so be on the lookout for it.
Dr. Callender, I've seen a commercial where they were, it was a group of people sitting around in a circle and they had the mask on. And then one guy did not. He was saying, this is the technology where you won't have to use this mask anymore. So they've already started advertising.
No. That is different. That's
Oh,
Inspire.
that's what?
Inspire,
Oh,
which is different, completely different. Inspire is an operation you have to have that allows for correction of some forms of obstructive sleep apnea. And so you have this operation. They don't go into details on the commercial, but that's a commercial for Inspire, which is
yeah.
completely different from what this is. This is CPAP modified so that it's easier to apply, whereas Inspire requires an operation where they affect the nerve that allows the phrenic nerve and other nerves that allow for, and also affects the tongue. So that's Inspire, which is different from this.
Yeah, they didn't say exactly on the commercial what, like you mentioned,
I know, but it's for Inspire. That's what it's for.
I see.
And
Okay.
that's why I discussed Inspire about several weeks ago, because it's an alternative that for it's effective for some patients, not all, but you have to go to a surgeon, be evaluated, and find out if this particular operation will benefit you and take care of your obstructive sleep apnea. But that's Inspire, which is completely different from Vortex PAP.
Thank you for the clarification.
Okay. Now, this is something that you may or may not be aware of, because in the hospital, drug shortages are very common now. 10 years ago, that was not the case. Now, many drugs are unavailable. And this talks about the fact that it's getting worse. And it talks about the only way to solve it is to deal with I think Darryl mentioned the fact that a lot of it has to do with the people who make medications. And if you have only one retailer pharmacist making the drug, then that's not going to be effective. And so you need to have more than one retailer that's making the drug. And you also need to, they are saying you need to have penalties when the drug company isn't capable of meeting the need. So they're saying that there are many ways of addressing this problem. We've addressed none of them in the past. And it suggests that this is something that requires an effort because the problem is bad. It will only get worse unless we take some steps, which they talk about, trying to make the pharmaceuticals more responsible and responsive to the needs, so that this drug shortage, which many patients are unaware of, but hospitals are very much aware of, and doctors who order medications are very much aware of. This is a problem that needs to be addressed and solved. But up to now, we've actually done very little about it. And this is a good article. This is one of the first I've seen that recognizes that we need to hold the pharmaceutical industry accountable to make sure that they have the drugs available that we need to keep patients safe.
It's funny, Dr. Count, it's funny how they're trying to reduce the cost of drugs, and now we talk about a shortage. When there's a shortage, and prices go up. So,
That's exactly why we need to eliminate the shortage.
mm-hmm.
A good point. But it's something that most patients would be unaware of. Hospitals and doctors would be aware of it, but patients probably wouldn't be aware of it. Let's go to the next graphic, please. It's interesting that most people are aware that chronic kidney disease is a disease that is associated with many hospitalizations and actually a very high death rate. Its death rate from chronic kidney disease is very comparable to that of cancer. But what most people don't recognize is that adverse drug reactions is responsible for many hospitalizations. And so knowing side effects and making patients aware of side effects becomes very important because it would decrease the number of people who are hospitalized. Adverse drug reactions, we're just talking about side effects from medication. And so if the patient develops a side effect, they should let their doctor know immediately. The problem is that often patients, when they have a side effect, they're unaware of them. And then when they become aware, they try to notify the doctor. They often cannot successfully reach the doctor and get the feedback that's essential. As a consequence, they may wind up needing to have an unnecessary hospitalization, which might be prevented if there was better communication between doctor and patient as relates to adverse drug reactions or side effects, and what to do about when you have a side effect is to stop the medication and get a substitute for it. You can't keep taking the medication that gives you the side effect. So that it's important to recognize that and that improve the doctor-patient communication, particularly for patients who have chronic kidney disease. Any comments or thoughts about this?
Yes, Dr. Callender. When I was in Georgetown Hospital back in the day, a doctor asked me, do I have a problem with taking prednisone? And I told him no. And so he did prescribe that. But I wish I had said, yes, I do.
Now, he asked you if you had reaction to prednisone?
Well, not a reaction so much as do I mind taking it, period.
Well, the thing is, it's an anti-rejection medicine. And so if you don't take, it's one of the better anti-rejection medicines. So if you don't take prednisone, then you're missing a very important anti-rejection medicine. It does have side effects, very common side effects. So in some instances, you take the medication in spite of the side effects because prednisone has many side effects. It has you gain weight, you get fluid, it causes hypertension, it causes diabetes, it causes many things that are not pleasant. The problem is that there aren't many anti-rejection medications that are as powerful or as good as steroids. So So if you eliminate steroids from the treatment, then it makes your ability to avoid rejection more difficult.
I had a quick question, Dr. Callender. What is AKI?
Acute kidney disease. That, for example, you have acute kidney injury. For example, you have chronic kidney disease that occurs over long term, where you have an acute kidney illness where the disease is reversible. Chronic kidney disease, once you meet stage 4 and 5, is not reversible. Acute kidney injury is usually reversible after about 6 weeks. The kidney will return to normal. Whereas with chronic kidney disease, when it gets to stage 4 or 5, it's not reversible. So that's what acute kidney injury is.
Thank you.
Any other comments or questions about adverse drug reactions? This interesting article that talks about five common supplement myths. You know, we take all these different supplements like vitamins and all those things, and we have a lot of misconceptions about them and think that we must take them. And so this article talks about 5 of those myths, and let's go down to them one by one. First one is that everybody needs vitamins. And we talked about this many times, that if you're vitamin deficient, yes, you need to take vitamins. But if you eat a proper diet, you probably wouldn't need vitamins. However, it still ought to be tested to find out if you're vitamin deficient. So if you're not vitamin deficient, a good diet would obviate the need for vitamins. But just to be sure, you should get your doctor to test you to see if you're deficient in vitamins. And if you're deficient in vitamins, then you need to have vitamin supplements. The second one is taking vitamin B vitamins helps you lose weight. Actually, B vitamins help with a number of issues, and of course, it's best for nerves and other things, but it doesn't help you lose weight. So that if you want to take it for the good reasons, because there are many vitamin B deficiencies that exist, and so that's a good reason to take it. But don't take it to lose weight.
Dr. Callender, didn't they at one point they were always advertising what was it, vitamin B12 shots for weight loss?
Vitamin B shots, and I think that's not good advertisement.
Okay.
All supplements are safe, especially when they're labeled natural, and that, of course, is not the case. And so, as you can see here, it is not approved. Many of the vitamin supplements, unless they're indicated. Vitamin K is a good example, in which you may have an indication for it, in which case you should take it, but without it, it can be cause problems. Then the third one is that taking St. John's wort is effective at treating depression. And so far, while that has been commonly expressed, it is not thought to be a successful treatment for depression. And although that's something that has been passed along through the decades, but apparently there's no validity to that. Okay.
Dr. Callender,
Yes.
I'm sorry, once you get off that subject, I was wondering if we can back it up to that vitamin B info. I had a question. I was seeing a doctor regarding neuropathy, and he suggested that I take vitamin B pills for energy. Can you speak on that, or is that related?
It depends on whether your vitamin B levels are low. If your vitamin D levels are low,
Yeah.
then yes, it could be effective. So if you actually have a vitamin B deficiency, yes, that could be possible. Vitamin B12 has many uses in vitamin B6 and the other vitamin, especially if you are deficient in any of them. I would think it could help you with energy if you're deficient. If you're not, I wouldn't agree.
Mm-hmm. All right, thank you.
Okay, going down the list, we were at John's warrant, and mushrooms, even in supplement form, are beneficial, and I think that mushrooms are okay, and they are beneficial, but it's like anything else. Evidence supporting the health benefits of mushroom vary, and it tastes good to me, and they're okay. But there's not a whole lot of evidence that suggests that they're vital.
Dr. Callender, have you heard now? I see people talking about this mushroom coffee.
Never heard of it.
Mm. Okay.
Anyone else on the call familiar with mushroom coffee? I'm not familiar with it.
My husband just said he's seen the articles on Facebook. So,
And I've seen the articles on YouTube. I was like, mushroom coffee. Talking about the benefits of mushrooms and the vitamins you can get from it. And when I saw the article mentioning mushrooms and vitamins, it's a new thing now about mushroom. It's grind up into a powder and you can drink it like you drink coffee.
Well, I think mushrooms taste good and they're okay. They have some benefit, but so far, scientific evidence of that benefit still is missing. But I like mushrooms, and so I enjoy eating them. But it's just like probiotics, which they are a source of probiotics, and we still have many controversial articles about the value of probiotics, and so mushrooms kind of fit into that category.
I know as you age, or as I aged, my doctor just decided to start giving me things like calcium and vitamins. And I don't remember her testing me necessarily to see if I was deficient. So is that just something that your doctor just normally does as you age? You figure that you need it?
Well, there's a lot of controversy about that, but there are many studies that indicate that people of color have more vitamin D deficiency than others, and for that reason, and as you know, as you age, you get osteoporosis, and so for that reason, vitamin D and calcium are often given, particularly if you get a vitamin D level and find out you're vitamin D deficient. So many doctors will get a vitamin D level and find out if you're vitamin D deficient, and if so, they will replace it with vitamin D and calcium. They will also do tests for osteoporosis to see if your bones have enough calcium in them. And if they find that the bones are deficient, vitamin D and calcium would be recommended.
Well, that's what I'm saying. I don't remember taking any tests to see if any of these things were deficient, but she told me that I should start taking it. So,
well, it's very common in people of color, but I can't speak for whether your doctor did the vitamin test or not, because I know my doctor does vitamin tests, and and but I think, for example, they believe that one of the common causes of renal disease and other things like that is related to vitamin D deficiency. But I think it's a good idea to have the vitamin D level test done. But some doctors will give vitamin D and calcium as you age because they think your bones become deficient in calcium and vitamin D. But I can't speak for your doctor.
Dr. Callender,
I think the vitamin D level is good to know.
what I was going to ask is where bone density tests play a part in the vitamin D supplement.
Could you help me understand your question a little better?
Yeah, the Dexicam. When you're testing your bones for density, is part of the solution taking vitamin D if your bones are
Yes, if you have a bone density test and the test shows that you have osteoporosis, which means you're deficient, then vitamin D and calcium are recommended.
Thank you.
Yes, good morning, Dr. Callender and everyone. Yes, I had a bone density test, and one thing my doctor does every time I visit her is she says, "Are you taking your calcium?" And I says, "Yes, I'm taking my calcium supplement plus my calcium supplement comes with calcium plus D3."
Mm-hmm.
Thank you for sharing, Elizabeth. Next slide, please. This is interesting article on Beethoven. You know, the high lead levels can affect many parts of your body, including the brain. Apparently the testing of his ear suggested that this may have been why he had many problems, including deafness. It goes back to the fact that there's so many ways that we can be actually poisoned. Sometimes it's the water, sometimes it's many sources. And it appeared that this may have been responsible for some of his ailments. I guess there's not much to say other than that. Any other comments you want to make about Beethoven and the lead issue? Because you remember the problem in Michigan in which the water was the source of lead toxicity for many.
There was also an article which has no bearing on this, but they also said that Beethoven was Black.
Well, okay, all right. Black, white, he's a great musician.
Mm-hmm.
Okay. All right, next article. This is an article that was very interesting because it points out how musical engagement strengthens memory in older adults. It points out that the piano players, the organ players, the musicians who play instruments, and even people like me who sing in choirs are mentally affected, and their mentation is improved by what they do. Of course, it appears that those who actually play instruments are the ones who have the greatest positive effect. Especially, they talk particularly about the piano players, organ players, and all that. The benefits of the social aspect is important, but even more important is the music chord. that is associated. And many of you on this call are musicians. What are your thoughts about it?
Well, I definitely hope that it's true,
Yeah.
but I play a horn and the keyboard and sing all at the same time. But if I don't have my iPad with my music, my sheet music in front of me, I'm kind of lost a lot of times. I can't, you know, have about 1,000 songs in my iPad, sheet music that
Wow.
I refer to. So um, I, I hope that it's true, that it helps me to keep the memory that I have.
Carol, what do you have to say? If you're a piano player,
Hopefully it's true. I've become sort of lazy because I rely a lot on the music than just memorizing the songs. And but I guess if I, push myself enough, I would just go ahead and memorize it rather than just be dependent upon the music. But I guess it does help. Darryl is into it more than me. Darryl?
Well, yeah, it certainly helps memory, but most importantly, musicians are sexier
Okay. Why?
because it strikes a chord in the sexy region of the brain.
Oh, okay.
okay. Any more comments to go to the next one?
Yeah, the other thing I would say about this is that um, the memorization is probably the key to that article, because when you're reading, and that reading music, that's well, because that's along with reading the newspaper and so forth. But if you could memorize 1,000 songs, then your likelihood of getting Alzheimer's decreases.
That's the Tatum hypothesis.
Yeah.
That's the Tatum hypothesis. Not proven by anybody, but it's a Tatum hypothesis. Okay, because that article doesn't particularly talk about memorization. It talks particularly about the chord and the discipline that goes along with being a musician.
They also don't talk about the breath, the breathing, and we've talked about that before. Even during singing, your deep breathing, and that also helps your brains and socialization. So there's several things, but they're going from the aspect of what particular, just a memorization to help your brains.
Well, they didn't say anything about the. They talked about the cognitive reserve and the cognitive process, and I think it all works together. I think uh, the mental processes that go along with music and musicianship. So much of that. I don't know any musician who doesn't use his mind when he uses his or her instrument. And so.
But there's two types of musicians. I don't know if they're alluding to the ones that are reading the music or the ones that are playing by ear, and the vibration, like A is 440, the vibrations, whether they have any effect upon your mental agility.
Yeah, it doesn't deal with that. You're right. Yeah,
Uh-huh.
yeah, it doesn't address that. Now, this is an article that talks about women physicians need to have more family planning support and education. And it points out that women physicians are less likely to have the proper family planning for pregnancies and what to do after that than other people. And so that the wellness aspect of a woman being a physician is often not addressed properly. And that in the future, we need to do better about that for female physicians. Any comment about that? I think it's something that was taken for granted, but it's not good enough. We got to do better about that. And I think this is one of the first articles to really emphasize how being a woman physician and raising a family is more than a notion. And most women are not helped in this area because it's presumed that they know about it, which is a mistake.
We need Dr. Perez on here today to give us her opinion.
Yeah, yeah, you're right. It would have been nice to hear her perspective on this. Yeah. Okay, let's go to the next one. This is a kind of surprising article that says heart attacks have declined, but nothing's changed about the way we treat women and people of color. They still don't have the angiograms or the percutaneous interventions that men and people of color get. And that, yeah, we have fewer heart attacks, but it's not our fault. And so that we still have to do better, that the disparities in cardiovascular interventions remains a situation where Latino Hispanics, women, and other people of color still are not getting the same treatment as whites are. And so I think that's the gist of this article, that, yeah, heart attacks are going down, but that doesn't mean that we have done anything about the disparity that exists between men and women and whites and people of color. That's the essence of it, that these inequities remain. And we still got to do something about it.
Dr. Callender, what is the STEMI?
In other words, those are cardiac angiography and percutaneous interventions. Those are things that if you have chest pain, just about every patient should have those interventions. And if you don't get those interventions, then you're going to miss treating properly people who have heart disease. And that's what they're talking about.
Thank you.
And this was revealed at least 10 to 15 years ago with the hope that as a consequence, we would do better with the handling of women and do better with the handling of people of color and Latinos as well. And what they're saying is that has not yet occurred. Okay, let's go to the next article. This is an interesting article on intermittent fasting and whether the high intensity efforts are a fad or a real fix. And, you know, the intermittent fasting is something that we've had controversies about. Some say it's good, some say it's bad. And then they did a good test on those people into putting people into each of three groups. And they found that there are benefits in all of them. And I thought the group that was the most interesting was a group that didn't eat after 4:00 p.m. And it's interesting because those groups all did well. And so those different kind of treatments limit the amount of calories you take, and that is probably the reason that they're effective. And so it does appear that it's not a fad, but that it could be a fix. And so, and I like the way he concludes that those interventions that lead to weight loss are those things that result in better health. The dietary intake findings are surprising across the board because whenever you decrease the number of calories, the people did better. And that it's just important that people decrease the calories and that whether you do the intermittent fasting or you eat between 8 and 4, I mean, you don't eat after 4 p.m. They all had benefits on the glucose insulin ratios and benefits on the health, the lipid levels as well. So it appears as though that that it's not just a fad, but that limiting calories affects the blood pressure positively, affects the cholesterol level as well. And so it does seem to be advantageous. How many of you have had any intervention with any of these efforts, whether you do intermittent fasting or you don't eat after 4 to 6 o'clock? I remember once I talked about this on a TV program, and they almost booed me off the stage for suggesting not eating after 6 o'clock. But I found that that's one of the best ways to lose weight is to do all of your eating before 6 o'clock, and after 6 o'clock, eat nothing or drink nothing. What are your thoughts? Let's get some feedback from you relative to these efforts.
I try not to eat after 6:30. It's a challenge. And normally in the
But it
morning,
works, doesn't it?
morning time. So they say the window is eat, don't eat for 16 hours, and within that next 8 hours, eat. But my problem is sweets. So I don't know if the intermittent fasting is doing me any good as long as I continue to eat these sweets.
It's interesting how they let them eat anything they wanted as long as they didn't eat after 4 o'clock.
Yeah.
What do you do the rest of the day? Maybe I have a different metabolism.
Nice.
I'm hungrier around 6. So I normally eat 6:30 or 7 o'clock. I'm not a real sweet eater, and sometimes later I'll want something and I'll have fruit or crackers. But if I have a meal, I prefer 6:30, 7 o'clock. It's more satisfying. And if I eat a good meal at that time, then I won't want anything at 9 or 10 o'clock.
I think the problem is eating late and sleeping on it.
Yeah.
So that I think that's a big problem. That's why they try to tell you stop eating at a certain time and fast, in essence, fast for these 16 hours. Because the body is trying to get itself together within the 16 hours, especially while you sleep. But normally for breakfast, I don't eat. I normally eat breakfast maybe 11 o'clock, 12 o'clock.
I normally try to not eat after 6:30 or 7 o'clock. And I normally don't start my eating process again until maybe about 11 o'clock. And I'm like Sylvia, I have a problem with sugar. If I can overcome that, I've overcome salt, but I have a problem with sugar. And at night, sometimes I would sneak some yogurt in. But when I took my last blood test, my doctor told me whatever I was doing to continue because I was one of the better blood test results that I had received in quite some time.
Well, as for me, Dr. Callender, it's a work in progress that I've been working on for some years. But my goal is, and I try hard, to make sure I eat between 3 and before 6. Because I noticed that my schedule slows down after that 6 p.m. I mean, it really slows down. I'm very active before then. And so I work hard. So I've been successful this month to eat by 4 o'clock. Okay. The other thing I do is I make sure that I eat the darkest green vegetable and that sweet potato with nothing on it. The natural sugar just from the sweet potato, nothing. And that has helped me a great deal because I don't have the cravings for the sweets anymore.
I like the idea that you said they ate anything they wanted to eat as long as they ate it before 4. So I'm in the process of trying to lose weight. So I just weighed myself yesterday. So between now and the 1st, I'm not eating anything after 4 o'clock, and I'll let you all know what happens.
Any other comment? It's 10:30, so I think that.
Yeah, that picture that's up there is all my favorite thing.
Okay,
One thing I have been trying to look at is the labels of how much sugar is in different products, and you'd be amazed. Like there was a bottle of cranberry juice at the church one lady was drinking. It had a total of 56 grams of sugar in that one little bottle, and she was like, "What?" And so they say that's what's killing us, and I'm sure Darryl can chime in on the sugar issue, and Elizabeth also, but that's the thing. We look at the labels. That's what I'm trying to start doing, looking at labels as I try to introduce this intermittent fasting in my schedule. And so when I go to the store, I'll look and say, no, don't get that. So I'm working at it. It is a work in progress.
Okay, it's 10:30, so we'll close at this. Any other comments you want to talk about before we say goodbye?
Is honey better than sugar?
I'm sorry?
Is honey better than sugar use if you want to sweeten something? Is honey?
Oh, honey, yeah, it appears as though honey has its merits over sugar. Yeah. Well, of course, most people think that sugar and salt are the 2 of the most toxic substances that we eat. But honey is thought to be preferred over sugar. What are your thoughts, Darryl?
Yeah, slightly better, but it's not a needed nutrient. So, the body treats sugar as sugar, whether you're getting it from honey, table sugar, alcohol, it's all sugar.
What about sugar cane?
Sugar cane, it's all sugar.
Agave?
It's all sugar.
That's what I've been using instead of sugar.
Stevia? Stevia?
The artificial sweeteners, they've got some problems. If you got a sweet tooth, your best strategy is try to lose your sweet tooth.
How?
I'd have to get all implants.
Well, the main reason why you give up anything is you have to identify a reason to hang on to something that's good enough to keep you on track. And then if you can go 21 days without it, you lose the taste for it. Not entirely, because you can quickly get it back, especially sugar. But you go 21 days without sugar, you eat something sweet, and you go, ooh, I don't like that. It's too sweet. But before that 21 days, you were fine with it. But you're not going to be fine with it after 21 days. You go 21 years, and you can't stand it. You got no problem.
Mhm.
I wanted to go back to an article that we talked about this morning. We talked about the implant for the brain and how if you can use it to control your computer in your mouth. Is this similar to what they were working on for Stephen King, who was confined to a wheelchair?
Is it similar to what?
What they were trying to develop for Stephen King, the guy who was confined to a wheelchair.
Stephen King, I don't know about what Stephen King did, but so I don't know anything about what Stephen King did. You talking about the horror guy?
Yeah.
No, he was a quadriplegic scientist.
Oh, to him, yeah. It's similar to that. It's similar to that. Yeah, but that is not, that's his name, Stephen King?
No, that's
Because
Hawking.
I
No,
remember how
Hawking.
it helped
Stephen
him.
Hawking.
Yeah.
Stephen
Stephen
Hawking, he's
Hawking.
thinking about.
Sorry about that. Yeah.
Yeah.
Hawking.
Stephen
Yeah,
King
because
is the
it did
writer.
help him. It did help him, and it's when they have it worked out, I think it will help many people. But there's still some details they've got to work on. But it did help him, and it's helped many others. And I think they have an FDA approved study that they're now involved in. And so when they worked out the little details, I think it'll be helpful for many who have some of these muscular diseases, which they can't use their muscles in their body, but they can use their thought processes. So I think down the road a piece, I think it will be very helpful. Okay, thank you very much for attending. Look forward to seeing you guys next week. God willing.
All right.